Hello, friends, and welcome to another episode with Dr. Westman on Conversations with Dr. Westman. This is going to be episode 4, and today we're going to be chatting about long-term effects of a low-carb diet. How are you, Doc?
Doing great. How are you, Glenn?
Fantastic. Good to have you on again, and excited to chat about today's topic. So let's hit it off. And first question I have for you is that you often hear that people say that a low-carb diet doesn't have the science behind it, and it's still unknown in terms of its safety. Is a low-carb diet harmful?
Well, no, it's not harmful. That's pretty well established with the best level of evidence we have for any other diet. I'd say it does not cause harm. In fact, it is a beneficial thing to do, but we're going to have to talk, for 10, 15 minutes about this, because how do you define long-term, and how do you define health and wellness and absence of disease, things like that. The science is most solid for treatment of diseases. And that's been since the year 2000. There have been dozens of studies showing that a low-carb diet can fix problems. Like it can fix obesity and diabetes and pre-diabetes and metabolic syndrome. And so it's pretty, I've met many colleagues who will say, okay, the science is clear that it's a therapeutic diet. It can fix these things. But then they stop and say, but then what happens in the long run, right? So as if after you fix these things, something terrible is going to happen, right? I mean, which is kind of illogical. Yes, clearly they're not harmful. And actually that's a big step to say that, because 20 years ago when I was getting into the research in this area, people thought it was harmful. I mean, people thought eating fat would, you would keel over in a day. I mean, all the drama about how bad it was. And so clearly it's not harmful. I can say that. So, and that's a big step. And I think that's generally recognized in the scientific world through clinical research studies that have been done.
So I think that the main reason why that's come about is obviously for years and years we've been fed this notion that fat obviously is harmful, clogs up your arteries, and over the past there's been so many doctors that have been against this type of diet. I know that you were one of the few doctors that actually received private funding from the late Dr. Robert Atkins. And obviously he had it a little bit worse than we have it obviously today. In those days, everyone was thinking that it was absolutely terrible for you. And obviously over the years, there's been more and more science that's backed up the idea that it's actually good for a lot of different metabolic related type of issues. But I think that there's still some doctors today that fear this type of approach. Why do you think that is?
Yeah, well, the teaching we received said it was bad to eat fat. But there's another, so there are the clinical trials for obesity, metabolic syndrome, and diabetes. That's one set of knowledge we have. But there's also another line of thinking, and I wouldn't say it's high-level research, but it's the observations, it's the cohorts, the hunter-gatherer paleo idea, the primal paleo world. Basically, humans, it's argued, didn't eat many carbs until very recently, and recent meaning, last few thousand years, or maybe 10,000 years even. And I know that seems like a long time, but in all of human history, it's not. And then people really didn't eat sugar until, the last 100 years. I mean, it wasn't available in such large quantities and all of this. So there's well, we would call it face validity, or the logic or common sense that if people hadn't had carbs for all this period of time, what was their health like? And best we can tell, and there are arguments about this left and right, but I think most experts agree that, sugar wasn't around, and if there were carbs in the diet, it was every now and then, unless you lived in a tropical area on Earth. And yes, the world's a big place. There are lots of ways to eat, and you can't make sweeping generalizations about pretty much anything. But most people agree that a lower carb diet, not necessarily keto by any means, but was a healthy way of living, and maybe even humans evolved to be eating a lower carb diet, and so that we're not prepared to handle the sugars and all of the starches that get digested to sugars today. So you have the clinical trial knowledge, and then you have this hunter-gatherer, paleo kind of knowledge that I think is helpful. It doesn't prove anything by any means, but humans were healthy without eating carbohydrates in that way of thinking. So that's kind of different angles that we're getting at. What's your take on the kind of looking back at history and humans evolved, and is that meaningful for you?
So it is meaningful for me, but I think the most meaningful thing for me, Eric, is being able to do my own N=1 experiment. And there's nothing like having your own experiences. You can read everything. The thing is that if I went onto Google today and I looked at the camp that's against a low carb diet and the camp that's for a low carb diet, I could find both if I really wanted to. So I could find people that are against it. I could find people that are for it. But there's nothing quite as powerful as when you do it yourself, especially if you do it yourself and you test your metrics. You test certain blood metrics that you do, and you're able to see that over a period of 6 months, how drastically these different metrics change. So for me personally, the most important factor for me is my own N=1 experiment. And obviously, I'm a little bit luckier than most in that, obviously, over the last 5 years, I've traveled with you. We've done countless Adapt Your Life events, and I've heard, numerous unbelievable doctors, presenters, and great speakers talk on the topic. And I've had the privilege of meeting so many people where this has had a profound effect on their life. So at the end of the day, my conclusion comes from a slightly different place from the person that's just trying to research it. But
that made me think of another line of research that was kind of unpredicted when Prof Noakes in South Africa learned that he had diabetes, and yet he was an avid runner. He has a very brief video how he read our book, The New Atkins for a New You, thought it was a scam, but saw Finney, Volek, and Westman, who were scientists on the cover, were the authors of it. He read it, kind of changed his life. He tore out the chapter on nutrition in his book, The Lore of Running. Of course, Prof Noakes is the one who would teach you how to run a marathon. It was like the Bible to go to. Right. And so his transformation story was one of exercise. Now you have the idea of a fat-burning machine and running on fat, and the idea that you could learn and do something within a week and see results came from the exercising elite athlete community, actually. So that, I didn't predict that at all, although Steve Finney, one of my teachers, did his biker science back in the 1980s. It really hadn't been followed up over time. So we have the clinical trials treating obesity, metabolic syndrome, diabetes. We have the hunter-gatherer history, kind of low-carb history. And then now you have these athletes who are winning races in record time by not eating carbs.
Yeah.
And I remember at a meeting, it stuck in my mind that athletes aren't going to wait for the studies to come out. They're going to make a change, like you said, an N of 1. You're going to make a change and see the result, this week. Right. And following. So we have the athletes now who are, I guess, the closest to. It's not a therapeutic diet anymore for treating obesity. It's actually a diet to optimize performance, and that I didn't predict that would be rising up like this in terms of science. And Jeff Volek at Ohio State has published several studies looking at the metabolic effects of a low-carb diet in athletes. And I know that's partly how you got into this as a cyclist. And then being in South Africa, of course, you know Prof Noakes personally, which is awesome. So what's your idea on the athletic and or the research and knowledge from that area?
Well, first of all, as you correctly pointed out, yes, Prof Noakes, I think it was in 2012, read your book. And I know that he received it came into his inbox, and I've heard him actually tell me the story. Plus I've heard him present this at various conferences where the book came in, the publisher sent him an email, book came in on a Friday, he was about to trash the book. He saw that the authors were yourself, Bolick and Finney, and he said, but hang on a second, I know these guys. And he decided to read the book. And over the following, between Friday, Saturday, and Sunday, he read the book. It basically changed his life. And to this day, Prof Noakes is an avid CrossFitter. He still runs, I think, 4 times a week. The guy's absolutely insane. I mean, you see the muscle that he's put on. It's just absolutely incredible. And yes, it has absolutely changed his life, and it's changed my life as well. So I guess we're going to be covering this type of topic in future conversations where how much carbs is actually right. For example, does an athlete like myself need to stay in under 20 grams of total carbs? And I don't think the answer is correct. And I think we agree. In fact, there's some exciting news coming about in the coming months on this very topic. But for myself, it's changed my life. Yes, I have seen benefits from my exercise regime. I don't cycle anymore, do a lot of CrossFit. But at the end of the day, I think you said it earlier on today, the amounts of sugar that we've been consuming, if you had to take a look at the last 70 years, I've actually seen this slide somewhere before, but it's absolutely ridiculous. I mean, 70, 80 years ago, 60 years ago, we weren't eating nowhere near the amount of sugar that we're currently eating. And it's everywhere. So from my perspective, it's definitely helped. From people like Prof Noakes and other people that I know, it's most certainly helped. And like I said, I've been lucky enough to follow you around the country and meet so many people, and it's touched their lives as well. So, and I think you've been doing this for, 15 years, 15, 20 years?
20 now.
And, you've treated people with type 2 diabetes, hypertension, metabolic syndrome, PCOS. You've treated a whole, probably over 10, 15,000 people. Do you still have people that you've treated from 15, 20 years ago? Do you still have some of those patients that you have still today?
Yeah, we opened our clinic, I guess technically 14 years ago, 2006. And yeah, I still follow the same people. And I guess looping around to your initial question, what about the long-term effects? Sadly, we don't have clinical trials, like randomized trials for very many diets over 2 years. I mean, so there is as much evidence for low carb as there is for any diet in terms of duration of clinical trials. The nutritional epidemiology, which is observational, you ask people what they're eating and you follow them over time. I don't think that's sufficiently high quality enough to make conclusions about what to eat and not to eat. And a lot of the anti-fat stuff came from nutritional epidemiology. So I kind of think that's just not enough evidence. So the sad reality is we don't have a whole lot of data for long-term effects of any diet, let alone a low-carb one. But I am interested in getting together long-term followers of this to, it would be publishable to have 1,000 people who even, by self-report say they've done a low-carb diet and they're still alive after 20 years,
So
because the skepticism.
That led me to my question. If you've had people that have been with you for 14 years and some of those people are still with you today, how is their health after 14 years? Because I think at the end of the day, the proof's in the pudding. If you've been treating people for 14 years, How are those people today? Are they better off than when they first came to you?
Well, the ones who I still have followed and that come back to me, yes. But I don't have a complete follow-up in a clinical setting, which is what I've been doing as a clinic. So we'd have to do extra research to find everyone to see if they're still doing it and all that. So it takes actually a lot of money to do that kind of research. But there's no clinically apparent, the 20 years ago, people said everyone was going to die, and they're not. And I know that's a broad threshold, but I've treated people with heart disease and all sorts of problems like that people said couldn't be done. And but I guess what I'm trying to say is I do think more research is needed to quantify and track down with great detail and precision what happens in the long run. We don't have that beyond 2 years for pretty much any dietary approach, even vegetarian and Mediterranean, the ones that get popularized, and the people, the zealots, or they say it's the best and all that. And, well, we really don't know that for sure.
Good, 100%. So this is about the time when I'm going to be asking you some questions from some of our guests. So Rory asks, is there any type of deficiency one would get from cutting carbs? Should I be adding supplements and vitamins? Is there a carb deficiency?
No. So there is no, we call it an essential nutrient if you need to eat it, meaning your body can't make it. So there is no essential carbohydrate. In fact, we published a paper just in the last few months on that. If you go to PubMed and search TONT, T-O-N-D-T, and Westman, that paper will come up. But the micronutrients people are worried about because the carbohydrates, vegetables will bring in vitamins, minerals, things like that. So if you do a properly formulated low-carb diet or keto diet, there's no worry about micronutrient deficiency. But we watch kind of in horror or the different approaches that are on the internet and all that. You want to make sure it's a properly formulated approach, which means that you do pay attention to where the food is. You don't have just products. You have real foods, and actually, there are studies that look at the micronutrients and vitamins, and it's a balanced diet in terms of micronutrients and vitamins if you do a properly formulated low-carb diet.
Okay, that was from Rory. Next one is from Mandy. Mandy asks, will the addition of fat over the long period of time increase my cardiovascular risk profile?
No, and that was, I have to say, that was the big surprise, right? That was the science that was not predicted 20 years ago for me when I was doing our first studies and saw cholesterol levels get better, now to the extent of carotid thickness, so looking for the arteries, plaque on the arteries, that actually gets better if you do a properly formulated low-carb diet with more fat in it. So the best I can explain it, and this is a study by Steve Finney, Jeff Volek, Cassandra Forsyth, when you take away carbohydrates, your body starts burning fat, not having fat go around and around. In fact, the amount of fat in your blood, the saturated fat, goes down when you eat more fat and don't eat carbs. And that's because you're burning it. I know it's kind of hard to explain. If I had a whiteboard, I could show you, but the metabolism changes so that the fat you eat doesn't become a problem. And I know it's called a paradigm shift. It's like, teaching people that the earth goes around the sun and the sun doesn't go around the earth, because we were all taught that fat in the food went to fat in the arteries, and it's more complicated than that. So I don't worry about teaching people to eat fat as long as it's natural fat. And I don't ask people to add in fats and oils and things like that. I teach the kind of older school low-carb keto approach, not the nouveau keto where you're adding in MCT and coconut oil and butter and things. So we don't really know a whole lot about that other than ketone levels go up and it can make you feel well and take away hunger. So I'm still kind of old school in terms of using a real food kind of approach. But no, it turns out when you look at the cholesterol levels, yes, the total and LDL cholesterol might go up. That's the old way of looking at the blood profile. But the triglyceride and HDL, almost 100% will improve, meaning triglyceride goes down, HDL goes up. And that's called the metabolic syndrome, insulin resistance. It's shifting the worry about cholesterol and fat in the food to a worry about sugar and the sugar in the food, and then the blood fats are the triglyceride, not the cholesterol and LDL. So
Gotcha.
I've given lectures on this. You can YouTube them, and a colleague of ours, Dr. Nadir Ali at the University of Houston, has done some excellent YouTube lectures on why the LDL might go up on a low-carb diet. He's a cardiologist and explains, I mean, I didn't know that LDL helps you fight infections, for example. You know, so anyway, it's more complicated than what most doctors are taught.
Well, the good news is on episode 5, which will be next week's episode, we're actually going to be doing a whole talk on cardiovascular health and a low-carb diet. So we'll cover that one then. I've got 2 more questions. One of them is from David, but I think you've already answered it. He asks, can I follow a low-carb diet forever? I think the short answer to that is yes. All right.
Yeah.
And then Dorothy asks, how do carbohydrate diets, do low-carb carbohydrate diets lead to more weight loss and better health in the long term?
Yeah, I don't think we have great studies that are head-to-head clinical trials to say that one approach is better than another. But, you know, there's kind of this, it's almost anti-intellectual, the best diet is the one you can stick to. Well, not if it's not healthy for you. So I think, you know, the best diet is the one that matches your metabolism, nutritionally makes you healthy, and you can stay with it. We work really hard to help people stay on a diet that matches their metabolism. My colleague at Duke, Will Yancey, did a study where he actually gave people a choice of choose a low carb or a low fat, and then he compared that to a group who had no choice. So actually, an interesting study. They randomized people, meaning they flipped a coin, figuratively, to either having a choice or not a choice. And we're all kind of like, well, if people could choose what they would eat, they'd do better for weight loss. It's not what happened. So actually choosing what diet to go on for the weight loss, these people didn't do any better than the ones who had no choice. So it's more complicated than just saying, well, people they like it and all that. You know, if you're a real sugar addict, you're going to love it. You're going to love sugar. I mean, and like smokers, most smokers love smoking, and yet we know it's harmful and we help them quit it. So if the sugar is causing a bad metabolic effect, I'll work real hard to explain that and to get you off the sugar, even though you might enjoy it or love it. Fortunately, we use sugar-free things. We use substitutes for foods that people miss, so that they can actually do a satisfying kind of low-carb approach. It's not, there's no deprivation really, because you can find foods that you used to have, or you actually start eating new foods. And what would we do without good cheeses? So if you especially like the meat, fish, shellfish, poultry, eggs, cheese, cream, this is a great kind of approach that is sustainable for the long run.
Wonderful, Eric. Well, as always, thank you very much for your very insightful information. We really appreciate it. As always, if you enjoyed this video and you would like to see future videos, You can find us on YouTube, Instagram, Facebook, and Twitter under the name of Adapt Your Life. And if you're following us on YouTube, please subscribe and be sure to click the notification bell so that you can be alerted when the next video will be posted. And if you found this video at all helpful, please would you share it and give it a like. It would absolutely mean the world to us. And next week, as I mentioned, we're going to be chatting about cardiovascular risk on a low-carb diet. So this is Dr. Westman and Glen Finkel signing off of Conversations with Dr. Westman until next week. Thank you so much, Eric. Thank you.
Thanks, Glenn.